The topic is youth suicide, and we're talking to Mr. Clark Flatt, who is the president and CEO of the Jason Foundation. And of course, Mr. Flatt, before we had our second break, we promised that we would allow you during this last segment to talk about some of the warning signs dealing with youth suicide. And so let's talk about that.
Right. Well, of course, we finished the last segment with suicide threats. Self-mutilation, if you see your son or daughter, that is now becoming, was very big on the West Coast, is now getting to be a problem here in Tennessee with students cutting or slicing on themselves, which is a very beginning stages of a suicidal ideation. Of course, out-of-character behavior, that's just one that's really we tell people to look for, where your son or daughter or a friend, even if you're a young person watching, where you have a friend who is acting constantly, more than just a day, but it's 2 or 3 days in a row, out of character, a very loud person becoming very quiet all the time, or a very quiet person becoming very loud. Just anything that's totally out of character. Of course, depression. Depression is one of the leading causes, and people think that young people can't be depressed, and they can. Depression is one of the largest causes of suicide across the board. And we usually tell parents and students themselves that if the blues goes more than 2 or 3 days, there's a good chance that it's depression. And of course, final arrangements where you have a young person giving away prized possessions to a friend is another one of the good signals that something's going on. We always tell people that if you see 2 or more of these things in someone's life, it's time to really be concerned and to get actively involved in those people's lives and ask some questions. Don't be afraid to say, are you thinking about hurting yourself? You know, you seem down. You said some things that concern me. Don't be afraid to ask that tough question.
Now, if a person who might be watching this show this morning, Mr. Flatt, might have some of these might be familiar with some of these warning signs, what could you tell them in terms of what the Jason Foundation might be able to do for them?
Of course, we have a 7-day, 24-hour line that's with our clinical partner, Parthenon Pavilion, which is, if you call this number, even if it's on the weekend or after hours, you press 0, and it takes you straight to a phone bank of clinical specialists in adolescent behavior that are dealing with people, young people with these types of problems day in and day out. It's a free call. They can ask questions. It's anonymous. They can say, I would like to know, if as a parent, where can I get some help for my son or daughter? Is this something I should be concerned about even? Is it just, might be just adolescence? But the bottom line is whether you use the Jason Foundation or not, if you see these warning signs in an individual, get them help and get professional help. Don't try to handle it on your own. You might see someone who's in the beginning of suicidal stages, all they want is look okay, say, I'm all right, I just had a down period. And that might be true, but it also might be the facade there. So don't stop until you get them some professional help. Go to your pastor and ask them where to go. Go to your local mental health facility. The crisis intervention lines are good throughout the state of Tennessee. So, but just the main thing is to get involved. Don't just keep it within yourself. Get involved, act, and bring a professional in.
Well, now, how do we react when that really happens to us, Mr. Flatt? I think you've already indicated in your own life, in your own situation, but what's the normal reaction that parents have when this generally happens to them?
Well, it's disbelief. You know, they never believe it could happen to their son or daughter. By far, most people think that suicide happens to kids who for a bad sense of the term, are throwaway kids, which there are no throwaway kids, but they like to think it's not my son or daughter. By far, the young person that takes his or her own life today are the better than average student, the students with setting high aspiration goals for themselves, the cheerleaders, the football players, the class presidents, the ones that are wanting to do something with their lives. Those are the kids that we have the big problem with. And I see parents, when this happens in their lives, they go, I wonder why. I can't understand why my son or daughter would do this. And mainly it's because they didn't know the warning signs. They didn't know, first of all, that this was a threat to their children. And then secondly, didn't know what to do once they saw these things.
Now, you're taking your program into the metropolitan school system as well as some of the other areas. What kind of reception are you finding in doing that?
Yeah, overall, very well, very well. Dr. Vernon Coffey, the Commissioner of Education, State of Tennessee, wrote a very good letter to all the school systems throughout the state after he reviewed our program and suggested they put it in their middle schools and high schools. And of course, it's up to each principal. But we're finding overall very good response because our programs are in such a very positive sense. We try to help young people make good choices, positive choices. When it gets that time, and we all have those times in life where we feel like things are falling down around us, to be able to call upon your friends or to know what to do yourself to reach out for help. So,
okay, I think we've got about a minute and 3 or 4 seconds here,
Yes,
Mr. Flatt, before we finish this for today. But let's give you this last opportunity to make some kind of comment in reference to what you would suggest that we do in reference to this as an issue.
main thing is awareness. The first thing, if we can get people to be talking about it in their churches, to be talking about it at work, not in a hysterical type of way, but in a very informative, educational way of saying we have a problem here and we need to work together, schools, parents, teachers, educators all together to confront this problem.
Very good. And of course, let me thank you, Mr. Flatt, over the last half minute that we have here, for coming by and giving us that excellent discussion on youth suicide. And we know how very, very busy you are and how difficult it was to make arrangements for you to be here today. And we certainly appreciate you coming by and giving our audience that information. And I think that this is a method whereby people can be made more aware. And let us thank you, and let us encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.